As a nation, we have been following the progress of Congresswoman Gabrielle Giffords as she makes the long walk down the road of recovery after being shot in the Tucson shooting. To help give us a little more insight into her journey, we're joined by Dr. Robert Kreitsch, who is the medical director of Mary Free Bed here in Grand Rapids. And Doctor, I know you have a lot of experience with gunshot wounds and the recovery of this type.
I have, Dee. Thank you for the opportunity. The director of the brain injury program at Mary Free Bed. Yes, I've assisted a number of people through gunshot wounds to the brain during their recovery and rehabilitation.
Maybe you can start by telling us, what does recovery from this look like? I understand she was actually able to stand yesterday, which is stunning when you look back. For a lot of us, I think, it hasn't been that long since the shooting. Tell us, what kind of steps will she be taking? What does recovery look like?
Recovery involves a number of things. There are still medical issues that are being dealt with. There's still some tubes, but she's obviously communicating. She's conscious. She's making an effort to do purposeful things, and that's all positive.
There's physical rehabilitation, clearly, but I imagine a lot of the recovery is going to be mapped out as they evaluate where exactly the damage is in her brain. Can you walk us through that a little bit?
From one of the diagrams I saw that, yes, the damage seems to be all in one side, one hemisphere, though there is a concussion wave larger than the actual caliber of the bullet track typically, and there are secondary factors with swelling and bleeding and so on. But the biggest concerns, I think, are language and the movement on the right side. If the bullet track was predominantly all through the left side, then there may be some paralysis on the right, and there may be some visual difficulties with the area of the brain that processes sight, which is your occipital area. I believe the track either went through or exited from front to back, and there could be a field cut in her vision. There could be language problems with expression as well as comprehending language.
And I know you were telling us a little bit about the kind of concussion area, or that it could spread. You brought something to show us today, just kind of give an idea of the size we're talking about.
Yes, I don't know if this is helpful, but this is actually a 9mm casing, which is, I believe, the size of the handgun that she was shot with. This slug here is 38, which is essentially almost the same size. And as you can see, bullets do expand somewhat after they go through the skull and through human tissue. Fortunately, this probably was not a hollow point which explodes or expands more. It did exit, I believe, completely, but there could be areas of injury much larger than the caliber of the bullet itself.
Dr. Kreitsch, thank you so much for your time this morning. We appreciate you being able to put this in perspective for us a little bit as we look at the Congresswoman's recovery.